It's been said that mental illness doesn't discriminate, but some say mental health care systems do. Dr. Altha Stewart, president of the American Psychiatric Association, founded in 1844, is in Rochester this week to talk health equity for those some refer to as the silent sufferers. I'm talking about communities of color where conversations about mental illness are taboo and access to care is limited. Dr. Stewart recently joined me at the WXXI studios prior to her presentation for the Mental Health Association's Healing for the Village. The focus of the day-long summit is to work on creating community-led, culturally responsive approaches to mental healing. Dr. Stewart, I understand that working in the public sector for you is pretty much like working in the family business. You are from Memphis, your parents, your siblings all worked in the public sector, government jobs in Memphis. Also, your mother worked at the public library system. So this was a natural fit for you, what you're doing now. And I want to know, how has the family business, so to speak, given you a deeper understanding of the disparities that exist in our country, in particular when it comes to the healthcare system?
Well, when you're working in the family business, as it were, which is public service, you become keenly aware of the fact that for many people, service is exactly what they need. And in the healthcare arena, specifically mental health, there's so many people in need of mental health care, from young children who are having behavioral challenges that are impairing their ability to remain in school, to older people who are perhaps starting to suffer early signs of dementia and not able to live on their own and having challenges with depression and isolation, to everyone in between. And so for me, working in the family business, as it were, means that I've worked in the public sector my entire life. My professional career has been solely in the public sector, and I've seen every aspect of that system up close and personal, unfortunately, and I know that it does not meet the service needs of the individuals that we want to help.
Talk to me a little bit about that, because I've heard it said a number of times, mental illness does not discriminate. Mental health care systems do. Explain a little bit about that to me. I mean, how is this happening, and do we know, are we able to get to the root of why these disparities exist?
We know a lot about why they exist. What we're not as good at is figuring out how to reduce them or remove them altogether. We know they exist because people, particularly disenfranchised, marginalized people, people of color, poor people, people who live in certain zip codes, we know they don't have the kind of access to care. We know they don't get the kind of quality care. We know they don't often understand how the system works, and therefore they're not able to navigate as well as some others might. We know they don't have access to the funds to provide them with a level of care that public services just don't provide sometimes. And we also know that in many communities, particularly racial and ethnic minority communities, there is a stigma attached to being mentally ill that is almost as bad as, if not worse, than the stigma associated with being that racial or ethnic minority.
I know you've said this, we have to dispel the myth that mental illness doesn't happen in the Black community. We are suffering in silence. Talk to me a little bit about how the general conversation on mental health in our nation differs from the conversation taking place in the Black community.
Well, in the Black community, there is a sense of a taboo. If you are mentally ill, it is often said that you simply don't have enough faith, or that you're not right with God, or you've done something horrible and you're being punished, or you don't have time to be crazy. We made it through slavery. How can we get depressed? Or that's a white person's illness. Black people don't get depressed. They don't commit suicide. The reality, unfortunately, is that we have all of those illnesses, and we do all of those things that are harmful to our health and well-being. The tragedy is that we are losing people at record rates to suicide, to depression, to treatable and preventable illnesses because of our refusal to acknowledge that it does happen in the Black community, that we do suffer from these problems, and that we can be treated. One of the most refreshing things I hear today is finally the dialogue around Black people get mental illness, but they can also be helped. There are young people out there. Charlemagne the God is on a book tour about his own anxiety disorder.
A radio speaker and presenter.
Yes, and we thought, some of us in the profession thought, when Don King committed suicide, Don Cornelius committed suicide, Soul Train, everyone grew up on that. We all knew that. We thought, finally we're going to have this discussion. It didn't happen. Young people are committing suicide. We're not talking about it. We have got to break the silence. It is killing us if we don't begin to talk about this.
I want to know, in terms of health equity and how we can address these things that you just mentioned, what does healthcare equity look like? And I mean that, what does it look like when it comes to mental illness, mental health care, in particular for the Black community?
It means simply that wherever I am, if I have a problem or someone thinks I have a problem, before I do something tragic and harmful to myself or someone else, I have the ability, because I'm now armed with information, understanding of what the needs of my situation are, and the ability to make an informed decision about what I need. It means that I can go and get the help that I need, that I've got access, that I've got availability, that I've got people who are able to respond to my specific need within a context that is sensitive to my cultural approach to life and getting help. That all of those factors being equal, that I can get the help that I need, just like anybody else. That my zip code does not dictate my health status.
How can we make that happen in a community like Rochester? How do we create culturally responsive approaches to care and healing for mental illness? And this is really the focus of this week's Healing for the Village Summit that you will be speaking at. What are some realistic things, goals that we can attain as a community to make that happen?
Healthcare providers partnering with the community around real need and real solutions to meeting those needs. Training institutions becoming much more culturally aware of the needs of the population they serve and addressing them in a culturally responsive, appropriate, and sensitive way. Communities being willing to learn and engage in this whole practice of working with providers and not standing back waiting for something to happen. Taking the risk that if I sit at the table, I'm in a much better position to help shape the response, and being willing to stay in it for the long haul.
And how does that work in particular for teenagers? I know this is an area of focus for you in terms of teenagers that are dealing with trauma.
Us adults have to become much more aware of how young people are using social media as their treatment outlet. Kids are talking on Instagram and Snapchat and other social media platforms about very important and dangerous things: suicide, feeling suicidal, being bullied and not knowing what to do about it, having eating disorders or cutting disorders or other things that are impacting their ability to live healthy, whole, productive lives. We adults have got to get much more aware of these things as they are happening. We've got to become familiar with the technology so that we can appropriately interact on those things. And then we've got to teach people of that age group how to have these conversations also with their peers.
When it comes to mental health care and communities of color, how also can faith-based communities, schools, employers, even local government also get involved and have a seat at the table in terms of helping to bridge some of these barriers that have existed for so long?
Communities have to create champions. There've got to be people in all of those segments of the population that you just described who are willing to be there at the table as the champion for the community. They represent a respective area, but their common thread in the whole dialogue ought to be, I represent this community first and foremost. I'm a part of this community first and foremost. I care about this community first and foremost, and I want what's best for this community. And if everybody is in agreement at the table on those things, we can get some things done.
There's something that you said in an article that was really interesting to me, and you said the brain needs to be seen as another organ like the heart, the lungs, the spleen. You said if I come in for an operation on those organs, no one tells me to pray that condition away. And that kind of goes back to when you're talking about stigmas that might exist in the Black community. Explain what you mean by that and how changing our perspective when we look at the brain and mental health care can also impact how we treat this issue.
We would never say to someone who's having a heart attack, just don't worry, just go home. It'll be okay. We can't legally put you in the hospital because you're not a danger to yourself or others. We say that every day to people who come in mental health crisis. We've got to change the narrative around how we view mental illness, what we say to people who are mentally ill or are presenting with symptoms that may suggest a mental illness. And we've got to do a much better job of educating the entire public that mental illnesses are real. Effective treatments are available, but you have to be willing to accept them, and you got to understand that you need them.
That was Dr. Altha Stewart, president of the American Psychiatric Association. If you have questions or need access to support and treatment for mental illness, there are a number of services in our community that can help. You can start by reaching out to the Mental Health Association at 585-325-3188. You can also learn more on their website, mharochester.org.